National HIV Testing Day on June 27, 2013, AIDS.gov spoke with the director of the White House Office of National AIDS Policy about how HIV testing, recent federal HIV testing recommendations, and the HIV care cascade all help us achieve the goals of the National HIV/AIDS Strategy.
One of the goals of the National HIV/AIDS Strategy, the President's strategy, the first comprehensive national HIV strategy in the United States, is to get more people aware of their HIV status. We know that nearly a fifth of people living with HIV in the United States are undiagnosed. That is, they don't know that they're living with HIV. So in order to increase HIV diagnosis, obviously you need to get tested for HIV. Testing is important for a number of reasons. It's important so that people who are diagnosed can get the health treatment they need to improve their health and wellness, and also because we know getting tested helps people reduce their risk behavior. They can take the steps they need to protect themselves and protect others.
The U.S. Preventive Services Task Force released a recommendation that all adolescents and adults between the ages of 15 and 65 and all pregnant women be screened for HIV. Why is this recommendation significant?
The task force recommendations are a really big deal. This means that the leading agency that makes recommendations around screening for the health of all Americans is recommending that all adults and adolescents get screened for HIV if they're between the ages of 15 and 65. So this is really a big step. It's taken us a number of years to get to this step. Getting tested is more efficient and easier than ever before. In addition, it means that Americans enrolling in new health plans starting in 2014 can get HIV tested as part of preventative services without incurring out-of-pocket costs.
What is the HIV care cascade, and what does it have to do with HIV testing and the National HIV/AIDS Strategy?
So the HIV care cascade is really the steps that people move through from HIV diagnosis to virologic suppression. We know that testing is critically important for people to be diagnosed with HIV, and then virologic suppression really means that you have the virus under control, and that's very important to maintain your long-term health, and also because it greatly reduces the risk of transmitting HIV to others. So the care cascade is really as people move through the steps from HIV diagnosis to linkage and engagement of care to virologic suppression.
For more information on how you can get an HIV test, and for more information on the National HIV/AIDS Strategy, visit AIDS.gov.